Welcome back now to the health segment. We're going to have a conversation now with Dr. Kelvin Owusu, a wellness consultant. And we're talking about pelvic inflammatory disease. What is it? What do we do to prevent it? And if you do get it, what can you do to fix it? Dr. Kelvin.
Hello, David. Good morning.
How are you?
I'm okay.
But won't you talk about Dr. Kelvin now a consultant, a wellness consultant properly?
Oh.
The thing is that he's been a wellness consultant all this while we're having conversations with him. It's just that now I'm
zooming in
into the but that's what he's been.
And is it not worth acknowledging?
Oh, well, okay. Ladies and gentlemen, meet the wellness consultant.
Thank you very much. With a nice shirt at that.
That's why I like Frema.
Of course.
I don't understand you sometimes.
No, but if you boys now.
No, you say it like that. No, you can't do that. You can't do that. Look. All right, congrats. And
thank you.
All right. And so we are looking at pelvic inflammatory disease. What is that?
Well, I mean, so basically this is a female problem. You know, it's an issue to do with the female pelvis, and it's an inflammation, which means an infection. So let's start by defining what the reproductive system is, because this is intimately related to that. Now, the female reproductive system is divided into two. There's an upper portion and there's a lower portion. The upper portion is made up of the ovaries, the fallopian tube, and the uterus. The uterus ends in the cervix. So from the cervix coming downwards, so that's where we have the vagina, then we have the vulva, we have the mons pubis. All that forms part of the lower reproductive tract. You know. Now, pelvic inflammatory disease is an inflammation or an infection that affects the whole range of the female reproductive system. You know. So when it happens in various areas, it has different names. You know, so you can have vulval vaginitis when it affects the vagina and the vulva. When it goes higher, you can have Ufritis when it affects the ovaries alone, or salpingitis when it affects the fallopian tubes alone. When it's a combination of the two, then you have salpingo-ufritis.
Wow.
You know, so all that is a full range of infections that are part of the pelvic inflammatory diseases.
Okay.
You know? and it's a source of great concern, you know, both for us as medics and also for the women who are affected by this, because one of the most significant complications of PIDs is infertility. You know, of course, the gravest complication is death. You can actually die from complications of PID, but if you are dead, nobody cares if you are fertile or not. You're already gone. But once you are alive, one of the gravest complications is actually infertility. You know, a significant majority of women who develop either primary infertility, where they have never given birth before, or secondary infertility, where they have given birth but now are struggling to get pregnant again, is actually because of PIDs. You know, and it's poor management. You know, so it's a major source of worry.
Now, who can get this in terms of age?
So typically, the age would coincide with the age of reproductive age. You know, so from teen years all the way to menopause, that's the common age group that would typically get it. And this is because of the associated or the risk factors that actually predispose to this thing. The kind of things that will make you get it are it's more common in these women in this age group, so that's why there's that association. But technically speaking, every woman can actually get a PID, but the common age group is actually the age of reproductive, the fertile age group, yes.
And now let's look at the risk factors.
So every time we talk about the risk factors of PID, I always catch some flack, but hey, we have to talk about it. one of the
now you're a consultant.
I know, right? So no fears.
No.
So yes. So typically, the infections tend to come from outside, you know, and because it's one continuous tube, you know, from the vulva through the vagina, through the cervix, into the uterus, into the fallopian tube, you know, it can start from outside and then travel upwards and cause its damage along the line. Now, this movement is facilitated by some practices that women tend to do. You know, one of the key causes is actually how they treat the vagina. Now, as I've already indicated, the vagina is the canal connecting the cervix to the vulva. And a lot of the time, because of our cultural upbringing, there's a lot of interference in the integrity of the vagina. You know, women they do also things to keep the place clean or tight. And these things tend to introduce infections into that area. One of the key protective mechanisms that two key protective mechanisms that the vagina incorporates is that there are cells and there are some bacteria in there that produce acid. The goal of this acid is to kill any foreign bacteria or any invading anything, bacteria, protozoan, any germ that comes in there. The acid deals with it. When you interfere with this atmosphere, it kills off those bacteria that are producing the acid, so that it makes the place open to anything, you see. Then the second barrier is the cervical mucus. The cervical mucus is a plug that actually, prevents anything from going into the uterus, because the cervix is the mouth of the womb. Yeah. So the plug sits there and prevents anything from going through. Now, when the acid in the vagina is sort of removed by our actions, and the other bacteria invade, they degrade the cervical mucus, which means that anything can actually pass through and then go up there and cause problems. Yeah. However, physiologically means that naturally, in some cycle, at some point in the female cycle, the cervix is thin. So at that point, anything can go anyway. But this is made worse by the practices like douching, the tightening creams and all those things that we are doing. So that predisposes the woman to ascending infections from the outside, you see. And this is actually the major cause of PIDs, And so if we don't educate women on how to handle their nether regions, it can cause a lot of damage in future. Well, it causes the damage now, but we discover it later when you're trying to have a child.
Has keeping multiple partners got anything to do with this?
Oh yes. Well, that's the next risk factor. Okay. So first of all, the sex act itself predisposes to infection. You see, because the whole, it's morning TV, so it's a bit, but I'm a consultant, so yeah, we are going. yeah. The whole action of the penetration in and out carries some bacteria from the outside inside, and if for some reason your male partner is also not exactly clean, he may actually have some bacteria as well, carries it inside, and then the whole in-out pushes the bacteria higher up, which then makes it easier for them to enter the uterus and cause further damage. So that's one side. So and this is now further compounded by keeping multiple sexual partners. So you are having this same risk
multiplied over different partners.
Exactly. So yes, it's definitely a risk factor for PIDs.
Wow. Now, I do know that, like you said at the beginning, men don't get PIDs. But if the woman is infected, there can be some kind of infection that will be picked up by her partner.
Yes, so typically, even though we may not necessarily classify a PID as a sexually transmitted infection, some of the sexually transmitted, some of the germs that cause STIs can also cause PIDs. And so yes, there can be a transfer from one partner to another partner. So the man can get can get infected by the woman, especially if it's one of the the sexually transmitted bacteria or viruses that are in there causing problems. So yes, it's very, very likely.
Now, how do we deal with this?
So, once the key is to diagnose it early enough. If we diagnose it early, the treatment tends to be simple. Antibiotics. Okay. Now, these antibiotics can be given orally if it's not a severe infection, or may require admission and given, we call it parenterally. So that's IV or injection, IM, whichever. So the key is to identify that there's a PID going on. Typically, that's where the delay is. You see, because when the woman starts noticing symptoms, a lot of the time they take it as, oh, this is just normal, normal cramps or normal pain or normal discharge. Okay. Because those are some of the symptoms. They can give you abnormal vaginal discharge, but for you to know that it's an abnormal discharge, you presuppose that you know what your normal discharge is. Yeah. And it will surprise you to know that most women, they don't know.
Really?
Yes, you do get some situation you're like, but this is obviously not normal. Why do you sit in the house for 3 weeks with this problem? And so by the time they come in, they may have developed a much more severe infection, which actually may require surgery. Because if it does get complicated, it could develop into a tubal ovarian abscess. Now, this is a life-threatening abscess. Literally means that you have pus around the ovaries. Now, if this thing should rupture and involve the entire abdominal cavity, the peritoneum, now that's a recipe for disaster. And so, some have stayed in the house that long, you see, because they just thought, I'll just take some herbs, or I'll just listen to my friend.
But so let's know, even with a normal discharge, can I say that if I start experiencing this particular discharge, then we are looking at PIDs, so maybe this is the form that it will come?
So,
Are we able to tell?
the thing is, so from where I sit, I mean, I don't have any vagina, so I don't have a discharge. But from where I sit, I know that all through the cycle, there's some form of discharge, and the discharge would have different consistencies.
Yeah.
You know, and so as a woman, you should be able to tell how
The differences.
Yes, the different forms of normal
Yeah.
for you yourself, because you know that at this point in my cycle, this is how thick the discharge is, this is how light it is, this is even how it smells. You
Yeah.
know? So if at any point in that cycle you notice a difference, you should actually take it. You should be concerned, because it may not be a PID, but it could be cervical
something,
cancer.
yeah.
It could be something else going on. So you need to pay attention and then check it out, see what's going on. You see. And so ignoring something that's out of the ordinary is actually not a good idea. You know, I know that because of the economic challenges, people are delaying hospital visits, but
And they probably will pass to the pharmacy, go buy some fluconazole.
and that's also part of the problem. Unfortunately, the regulatory framework allows people to buy all sorts of medications over the counter.
Yeah.
So sometimes by the time they come to the hospital, a lot of the symptoms that would have helped us diaggnose early have been masked.
Yeah.
Like they've been covered by the several different
medications
medications that they've been taking. You see, so it causes a lot more delay in diagnosis when you actually pass all these routes before you get to the hospital. You see, and I mean, personally, this is one of the challenges I have with the pharmacy people. We as medics are not in competition with them, because when they come to us and we attend to them, they will still come back and then buy what is actually right. So why don't they just let them go to the hospital first, so that we can know this is exactly what we are dealing with, and then be able to treat it quickly.
Yeah.
You see, because if it's diagnosed early, let me back it up a bit. The reason why it will cause infertility, for instance, is because when the infection enters the fallopian tubes, the body's attempt at fighting up the infection is actually what causes the infertility.
Okay.
Because it's like you send the military to go and fight the enemy. There's going to be collateral damage. And the collateral damage is that it's going to destroy there are some cells in there we call them cilia. I don't know how else to describe it. It's like fingers that move the egg.
Okay.
Back, so when the egg is released by the ovary, these fingers sort of propel it through the fallopian tube. Now the fight between the military and the enemy destroys these fingers. So the egg is not able to move.
Okay, so are those the fingers there?
So this is an impression of this, but these fingers are inside the tube, so you don't see from the outside.
Yeah.
You see, so they get destroyed, and the whole tube is filled with pus. So in the body's attempt to heal, it sort of causes the fallopian tube to close up on itself. So the egg cannot move, the sperm cannot move, so there is no fusion.
Okay. Now, can this happen? Can it get a PID, naturally? So let's say that I'm not keeping multiple partners. I'm not doing any untoward way of trying to keep down under tight or whatever, or thinking that I'm keeping it cleaner. Can it happen if you're not doing all these?
Yes, it can. It can. So during menstruation, when the lining of the womb or the uterus begins to come off, there's some contraction, which is what causes the cramps. That sort of pushes the menstruum out. Now, in that contraction, some of the menstruum tends to also go back up through the fallopian tubes, right, and then may end up in the pelvis, That can also be a source of infection. Yeah. So typically, if you observe, and most women would realize that a few days after, when their period ends, a few days, they tend to have some low abdominal pain or low abdominal discomfort. That's actually kind of a PID, of a milder form. In some people, it can become quite severe, So we call it retrograde menstruation can also cause a PID or can be a source of PID. So it's possible that you are doing all the right things, but just because a little bit of the menstruum, went the wrong way, because that's why I started by saying it's a continuous tube. Yeah. It's open at both ends. So it's open at the cervical end, it's open at the fallopian tube end as well. So when it contracts, some of it will go up and then spill into the peritoneum. So that can be a source of PID as well. But because it's natural, it tends to be self-limiting. Okay. But in some cases, you might still need a medical intervention to get it well under control.
Wow. Okay, so worst case scenario, what can happen with the PID?
Die.
Bro, that is the worst case scenario.
Yeah.
But so apart from the infertility, if you should get pregnant, One of the risk factors is also ectopic pregnancy, and it's based on the same thing. So because the egg is not able to move, you see the sperm is very wild. It can find ways and means some small corners and then pass and then still go and fertilize the egg.
Yeah.
But now the fertilized egg cannot come to where it's supposed to be.
Yeah.
So a significant majority of ectopic pregnancy is actually due to PIDs. You know, so we really need to get this under control. So death, infertility, ectopic pregnancy, those are the three big ones that can be result from a PID.
What would you say is the incidence of PIDs in Ghana?
That's very difficult to tell because, as again, most people never come to the hospital with this issue. So it's very, very difficult to tell in Ghana, you know, but it is common. It is common. I mean, one out of every 5 women may be dealing with a PID. So it's common.
Yeah. Wow. Anyway, well, thank you. Thank you for enlightening us. I mean, this is something that I think needs to be addressed aggressively.
Yes.
Considering the possible outcomes at the end of the day. Okay, somebody walks into a consulting room. Your diagnosis, what was the first thing, or what are the first few things that immediately will say to you, think of PID?
History.
Okay.
So what's the person complaining about vaginal discharge, most likely offensive smelling vaginal discharge with low abdominal pain. So that's a you know, it tells you that you could be dealing with a PID. You know, when did they happen? Maybe it happened after the menses has ended. You know, that draws your attention there. And you may request a few things, a full blood count and a pelvic scan to sort of give you even though there is no classical test to tell you that this is a PID, apart from a laparoscopy. A laparoscopy is where you make a hole and they actually pass a camera to look and see what's happening in the fallopian tube. That is the gold standard. But apart from that, every other test would give you an indication that this is what's going on. And then we can treat based on that criteria that this is PID. And most of them would get they'll be fully recovered after a few days, actually.
Fantastic. All right. Dr. Calvin, I'm sure people are watching and they are having some symptoms of what you are describing, and they may want to reach out to you. How do they get in touch with you?
I'm very active on social media. You can find me at Kelvin, also MD, on all social media channels, so you can connect and then we'll see how best you can help.
Okay, fantastic.
Or find a consultant.
You know.
All right.